Hello, I'm Dr. Elizabeth Zhang, and I am an ophthalmologist and oculoplastic specialist. In this video, I'd like to talk about what to expect after you have eyelid surgery or blepharoplasty surgery. And so this is probably true for most eyelid surgeries, but I'm specifically going to discuss blepharoplasty surgery, which is probably the most common of the eyelid surgeries. And that's when you have extra skin and possible muscle and fat taken off your upper eyelids in order to lift the eyelid so that you no longer have blockage of your peripheral vision. This is also surgery that may be done for cosmetic reasons, meaning just done because someone wants to actually improve their appearance. So with blepharoplasty, there's typically sutures that are placed in the upper eyelid after surgery. And most surgeons will have you use some kind of ointment, an antibiotic, or it may be an antibiotic steroid ointment on those sutures. And you want to keep those sutures lubricated. So typically, I have my patients apply the ointment twice a day afterwards. After you have surgery, it's super important that you really ice or use frozen peas or frozen corn on the eyelids constantly. So, I instruct my patients for 3 to 4 days after surgery. Basically, if you can do 15 minutes off, 15 minutes of ice on the eyelid, and then you can take the ice off, and then another 15 minutes, put it back on. So 15 on, 15 off, and continuing that pattern. The more ice used, the less swelling you're going to have. And the less swelling, the sooner you're going to get back to looking like your normal self. You also want to try to sleep with your head elevated so that all the swelling can go down with gravity. You want to try to sleep on your back and not on either side, because if you sleep on one side, then there'll be more swelling on that side. And so then you can have a more asymmetric appearance after you heal. Of course, if you have a lot of swelling, you can even expand the skin that's left behind. And so it may look like not enough skin was taken out. After surgery, no heavy lifting, deep bending, or strenuous activity for a full 2 weeks. So it's most important in that first week, but 2 weeks to be safe. And the reason for this is that you don't want to have any bleeding after surgery. So you may have a little bit of like oozing, and you may have some kind of blood tinged tears, and that's fine. And that's usually for the first day or two after surgery. But if you do some heavy lifting, you may have a blood vessel actually start bleeding. If you get a lot of bleeding that started happening, that can fill up, cause more swelling, and then that can also cause pressure on the eye itself. And if you have a lot of pressure on the eye for a long time, that could actually potentially cause loss of vision. You want to keep the incision clean and dry. And so what I tell my patients is to take a shower the morning before surgery or the night before and wash your hair. After surgery, you can wash from the neck down, and you can wash your face with a washcloth, but you don't want to soak the area where the sutures are. And so I say wait 3 days until you actually wash your hair. If you really need to wash your hair before that, you can go to a hair salon where they can wash your hair in one of those sinks so that they're not getting any water on your eyelids. After 3 days, you can go ahead and shower, wash your hair, but just make sure like all the water's kind of going back and just not soaking on the eyelid. Depending on what kind of suture is placed, it may be removed about a week after surgery. I tend to use a suture that does dissolve, but if it doesn't dissolve, at some point I may actually end up taking it out. A lot of patients don't actually like the feeling of having the sutures taken out, and it does take extra time. I do find patients do well with a dissolvable suture. I did mention the ointment earlier. So yeah, you want to keep using that ointment until the sutures are completely dissolved, or as long as your surgeon tells you to do. So typically you'll see your surgeon a week or 2 weeks after your blepharoplastic surgery. That can vary depending on the surgeon as well as what kind of sutures they use. If for any reason after surgery you have a significant decrease in vision, you need to call your surgeon's office right away. Right after surgery, your vision might be blurred because of ointment on the surface of the eye. So when I do surgery, I do use a corneal protector, and I put some ointment on the inside of that corneal protector in order to keep it comfortable. And so just obviously having ointment on the surface of the eye is going to blur the vision to some extent, but you're still able to see. If there's any case where you really can't see at all, like you really need to call right away, because that could be a sign that something has just gone significantly wrong. In general, people heal really well from blepharoplasty surgery and really happy after the surgery. It's one of my favorite surgeries to do for that reason. If you are in the Northeast Ohio area and would like to consider upper eyelid surgery or any eyelid surgery, I am available. You can find out more information about me at my website, www.dreyelid.com. If you're already a patient, I'm putting you to watch this video so I can remind you of how to take care of your eyelids afterwards. I look forward to seeing you back in clinic. Thank you.